All right, so I'm Dr. Saporito. Good to see you all here today. You might wonder what a fellow is. Can you hear me? Okay. Is that better?
Yes.
All right. I'll just squat. All right, so a fellow basically means that I did 4 years of undergrad, 4 years of medical school, 4 years of residency in neurology, and now in my last year of training to become a headache specialist called fellowship. I chose to do headache medicine because it's, one, very rewarding getting to work with everyone and see them get better, and also because, as you heard, there's a huge need for headache specialists in the community. I'd like to thank my mentors, Dr. Karashi and Dr. Masroor, here today, and I'd also like to, of course, thank Miles for Migraine, not only for being great support for my patients, but I've also learned a whole lot through their ACT program, not only about how migraine affects people outside of my own clinic, but also how much stigma there's still around migraine and how that affects how people seek their care. I'd also like to kind of destigmify and demystify migraine a little bit, go through a couple of the phases of migraine that some people experience. So as we know, headache, it's not just a headache. Migraine is a whole brain disorder. So there are several periods of headache. Even in between headache, you can have what's called interictal symptoms, chronic nausea, light sensitivity, sound sensitivity. Days to hours before headache, there can be a prodrome. You can feel really tired, have a lot of yawning, urinate more than usual, have a lot of tightness in your shoulders. In about 30% of patients, this is followed by aura. It can look like a lot of different things. Most commonly visual aura, which is like bright spots in the vision, tunnel vision. You can even lose vision in one eye. This can be even things like numbness, tingling, weakness of one side of the body, trouble with dizziness, ringing in the ears, trouble speaking. Next up is the acute headache phase that we all know, usually very severe, can affect any part of the head, usually has nausea, light, sound sensitivity associated with that. It can last from hours to days. And then after that, the postdrome stage, still the migraine hangover sticks around for some people. That can last again up to 2 days at a time. Feel kind of crummy, tired, fatigued, brain fog we hear a lot about. So again, it's really important that we understand this is a condition to seek treatment. And that working with Miles for Migraine, coming together as a community and destigmatizing it will help people seek the treatment that they need and come to see us. All right, thank you so much, and I'll see you out there.